Dr. Naoko, Chair of UN Nutrition, senior government officials, UN colleagues and partners, ladies and gentlemen, Bula Benaka, a very good morning to you all from Fiji. On behalf of the Pacific UN agencies leading our collective response to malnutrition, including FAO, IFAD, UNICEF, WHO, and WFP, I would like to thank the UN Nutrition Coordination Unit for providing the Pacific with this important opportunity to present at this event today. In the Pacific Islands, the overwhelming success in developing the national food system pathways is exciting, and we have renewed hope that the Pacific will achieve the SDGs once these pathways are implemented. In recent years, we have successfully mainstreamed prevention of stunting within policies and developed and implemented high-impact nutrition interventions. We were able to reposition healthy and nutritious local food and diets among women, children, and adolescents, while more tailored investments have increased in nutrition-sensitive agriculture and value chains, and helped in building resilient agriculture, fisheries, and forestry production systems. There has also been progress in preventing and managing NCDs, and a new mobile vulnerability analysis and mapping (MVAM) system was successfully launched in Fiji, Samoa, Tonga, Vanuatu, and Kiribati. Despite these successes, there still remains an urgent need to invest further in nutrition in the Pacific Islands. A majority of young children in the region do not have access to a diverse diet due to a shifting of diets away from locally grown foods to highly processed and imported foods, contributing to a triple burden of malnutrition in the Pacific. This triple burden of malnutrition includes a high prevalence of stunting among children under 5, high rates of micronutrient deficiencies, such as anemia, and increasing overweight and obesity rates among young children, adolescents, as well as women. Food systems in the Pacific are particularly fragile due to the country's geographical remoteness, increasing climate shocks, and logistical challenges. COVID-19 has further exacerbated these challenges with reduced incomes and less social sector financing for nutrition. This is likely to be the case for several years, given the current debt burden of the SIDS. Pacific Island countries are among the most at-risk countries in the world for climate change impacts, which have significant consequences for food security and nutrition. Food stability and affordability is threatened by water and soil salinity, higher frequency and severity of extreme events, and the subsequent impact on crops, agriculture, and fisheries. Through the current UN Pacific strategy, outcomes 3 and 4 are focused on improving nutrition and food security, agriculture, and basic services, with significant expenditure in the 14 Pacific countries. However, it is not nearly enough, and in the new UN strategy for the Pacific being developed now, we need to go much further in such policy areas of labeling, marketing, and taxation, and the school environment. We need a real Pacific food revolution. There is also a significant funding gap to address the high rates of the triple burden in the Pacific. Increased investments will be required to meet the World Health Assembly nutrition targets. As you know, nutrition interventions are among the most cost-effective in the long term, with every dollar investment delivering a $17 return. It's critical to increase investments for nutrition in the Pacific, where more than half of the total deaths are linked to NCDs and have a huge burden on national health and economic systems. In addition, there's an urgent need to develop a nutrition investment case beyond salt reduction to include more nutrition targets representing the triple burden of malnutrition, particularly high BMI among women and children, breastfeeding strategies, marketing restrictions, food environment, fiscal policies, packaging, and labeling requirements. A strong nutrition investment case will aim to explain the health and economic burden related to the triple burden, the cost, returns on investment, supported by tailored advocacy products and an engagement strategy with key sectors. This could be piloted in countries like Fiji, Kiribati, and Tonga, due to their strong multi-sectoral stakeholder engagement in food systems dialogues and leadership in food fiscal policy, which would benefit all the Pacific Island countries. Disaggregated data and regular monitoring, including through MVAM, remains critical for evidence-based resource allocation and to ensure no one is left behind. A public sector expenditure tracking for nutrition has been initiated in the Pacific and is recommended to be expanded and continued to track progress on investment in nutrition. This is what is required in order to address the significant funding gap to deal with stunting in a few countries, as well as anemia, overweight, obesity, and other diet-related NCDs in all the Pacific countries. International nutrition financing needs to be further increased for the Pacific countries to address existing nutrition inequalities, fragility, and disaster risks, and must be tailored to the Pacific context in order to sustainably achieve the SDG nutrition targets. In a context where for many, the climate crisis is existential, this is more urgent than ever. Thank you for listening, and I wish you all very fruitful deliberations.